Tummy tuck surgery is a medium-sized surgery, and most often it is performed under either general anesthetic, where the patient is sleeping, or under a very deep sedation, what we call twilight anesthetic. Then you remove part of the abdominal wall, which is too much, which has too much skin and too much tissue. At times, this is accompanied by a liposuction, where some of the fat is sucked off beforehand, but also the skin can be dissected more carefully with the liposuction procedure. At the end, you should expect a flatter tummy, and you will have a scar line at the bottom of your tummy. There are various types of performing tummy tucks, depending very much on your tummy itself and on the clinical examination when you see us in clinic. Generally, tummy tuck can be done for various indications. Most commonly, it is done after weight loss, where a patient has lost significant weight, but there is excess skin on the tummy and the skin will just not go away. The skin doesn't retract after a certain age. Also, for instance, after pregnancies, sometimes the skin doesn't fully retract, and this excess skin would be ideal for tummy tuck. Other indications are if you have a rectus diversification, is when your muscles in the middle of your tummy are slightly distended and they cannot come back together. This is another good indication for tummy tuck, when you have a bulging of your tummy, and this can be rectified with a tummy tuck in an ideal way. Tummy tuck surgery is generally safe, even so it's a medium-sized surgery and we produce quite a big wound. However, in expert hands, it should be a safe procedure if all the rules are followed, which involves protecting you from developing of any thrombosis, which is a blood clot in your legs, being careful not to resect too much so you don't have problems with wound healing, and also being mindful about bleeding and leaving the wound field very dry, or doing specific type of tummy tuck, like a lock and glue lipoabdominoplasty, which we offer here in our service, which adheres the tummy and the skin envelope with some glue and some specific stitches, so you don't have a dead space and a seroma or blood or bleeding is avoided. Depends a little bit, the expectations and the outcomes depends on what your tummy looks like when you come to us. Sometimes tummy tuck is a cosmetic procedure where even a fairly skinny person with just some excess skin can have an improved and enhanced body contour. In other cases, you might have an abdominal apron, which is some excess skin at the lower part of your body, and that can be resected, which is almost more a functional procedure, albeit still will give you some cosmetic improvement. Once you have had a tummy tuck, and if you change your weight, you will have a change in your tummy again. If you lose weight, your skin will be lax and you might have excess skin again, even after a tummy tuck. If you put on weight, your fat cells, which are still underneath the skin, will grow and you will get a wider abdominal wall and your tummy will grow again. So the tummy tuck does not prevent you from changing your body. You should, after a tummy tuck, ideally look after yourself and make sure you're mindful about your weight and keep as fit as you possibly can.